like, how is just a 5-year grant program sustainable?
Yeah.
You create all these programs and you get partial funded for those programs, but what happens in year 10 when that funding's not there anymore, but the program is there? So hopefully you're able to create those revenues that aren't reliant on the grant dollars to fund that program.
There's a recurring theme in every episode we do about healthcare, and it goes something like this. This stuff's really complicated.
Listen, we didn't say it was an earth-shattering theme. Anywho, the recently created Rural Healthcare Transformation Program is no different. In fact, there's so many moving parts, we had to break this episode into 2 episodes.
Shareholder and CPA Kelly Klein, longtime pod listener, first-time guest, explains how the program came to be, how the funds are being distributed, and what rural healthcare facilities need to know.
Whether you're part of a rural healthcare facility, receive care from one, or like to keep up on the ever-shifting healthcare landscape, there's something for you. Listen in to learn more. Welcome to our podcast, Kelly Klein, one of our newest shareholders, and we are talking about a topic that just sounds so much fun, rural health transformation funds.
Yes.
So,
All right, so I thought maybe we could focus on what is the state of South Dakota doing with this $189.4 million in year 1? Okay, more in year 2. So South Dakota did come out with 4 focus areas, and within each focus area, they have different initiatives. So connecting technology and data, they're going to use that focus area to focus on EHR, telehealth, cybersecurity. Okay, connecting people to healthcare, helping improve the systems.
So if you don't have inpatient facilities in your rural community, maybe telehealth can bridge that gap a little bit.
Right.
It's kind of,
Hillary, do you know what you need to provide telehealth? You need your residents of the community to have access to the internet and maybe a device to actually do that.
so you probably should also have reliable internet service too.
Internet service.
That probably makes a big difference.
South Dakota has made an effort in the last couple of years to improve that access to internet and internet connection. So we are good. But is everything good? No. So that's a problem with telehealth. And it kind of takes away that being able to go into the doctor and see your doctor face to face.
Yeah, but that's a whole different experience than just doing it over a mobile device.
Yes.
Yeah.
The second focus area was advancing the rural health force. So that's kind of recruiting. There's a program called Community Health Worker. That's just another type of nursing type program. Training and emergency services like EMS. Okay. So they will develop programs and grant opportunities to help fund those areas.
Sorry, health force? That's a sick term, right?
Right. It's like Space Force, but so much better.
What health force?
I love it. Let's just add force to the end of everything.
Yes.
Accounted force.
All right, now we're getting somewhere.
Third focus area is keeping healthcare local and strong. I love that because it's just so fluffy. I don't know why that's my word of the day, but
It's folksy. I like it.
Sounds so nice. What does it mean? Nobody knows. This focus area will help specifically look at Medicaid reimbursement. So like I said, there was Medicaid cuts. So the state is also focusing on how do we help fund that. Maternal and infant health, like doulas. That's been a new thing that has come out with some of this funding is doula care. Behavioral health and chronic disease management. So those are things that are pretty standard in clinics and hospitals. So those, hopefully, whatever they decide those programs should be, will help put some funding into those healthcare entities to help provide those services.
So that's the idea of trying to keep it local. These are the areas we're focusing on in these local healthcare facilities. So
The last one is transforming systems for sustainability. Also like that one. I was like, ooh, that sounds
transforming. Who doesn't like to transform?
How is this? I look at it, I'm like, sustainability. Everybody loves that word.
Yeah.
But how is just a 5-year grant program sustainable?
Yeah.
You create all these programs and you get partial funded for those programs. But what happens in year 10 when that funding's not there anymore, but the program is there? So hopefully you're able to create those revenues that aren't reliant on the grant dollars to fund that program.
So trying to figure out ways to be sustainable, which do not require government whatever, them giving money? Like, is there other ways, either through programs, through some sort of initiatives that we offer, that we actually bring in revenue that's not dependent on the government?
Yes. Yeah. And that focus area is also specific to Medicaid. So there will be some things that come onto that. So what the state of South Dakota is doing is that the Department of Health is managing all of these initiatives and programs. So the state has a website that has all of the funding opportunities for everything, not just the RH2P grant funds, but every vendor that the state of South Dakota works with has to go through this RFP, request for proposal site. So you can Google South Dakota Rural Health Transformation and it'll bring you to this website. And then there is a link that you can click on there that will bring you to the funding opportunities site right there.
Who's applying for the funding? Is that the healthcare facilities?
Great question.
Okay. All right.
Right now in this phase one, they're not calling it phase one, but I would call it phase one, is that the state has come up with these like types of programs. Maybe it's like developing a system to help track XYZ.
Oh, okay.
Monitor the program. So most of the RFPs that are out there right now are pretty much for like a contractor to come in and build the software, build the program, a vendor. So not the end user,
Not the facilities.
not the facility or the people of South Dakota. So that will benefit.
Vendor. So essentially a contractor is applying for these funds.
First part.
First part.
And we need that. We do need that. But right now it was like, okay, are these grant opportunities going to be available for people to start looking at right now?
Right.
Not yet. But next week, the first round, according to the state, is that they were going to start putting the grant opportunities out there. So they might be called RFPs or RFA, request for application. Okay. So the first round, most of those have closed or are closing within the next couple of days for these vendors to submit their application to say, I want to manage this initiative.
I want to try to create a tracking for Medicare reimbursement, or Medicaid reimbursement, or whatever it is. Okay.
So some of the funding will be the setup of that. The thought there is that with each of these programs, then they will manage the distribution to subrecipients like the hospitals, clinics, nursing homes, whoever might be eligible for that program that they're trying to service. Maybe it's a college because maybe it's an education type program for nursing or recruiting or a specific thing.
So it's not like a vendor could apply for the funds and then decide and just get it and then decide, I'm going to sell this now to these facilities. So they actually have to provide it.
Yeah.
Okay. That makes me feel.
And there's more to come on like what that is, but that's the quote unquote funding opportunities that are out there right now. Okay. Is it relevant to hospitals yet? No. So nothing to do there, but there was a lot of anticipation like, okay, when do I do?
And I mean, that's fair. Like a rural healthcare facility is not going to probably develop a system or
statewide system for doulas.
Right. You know, they don't have the people, the technology.
Maybe our big systems like Avera and Sanford could do something like that. Right. But we don't know who was awarded those opportunities.
Do we know who applied? Is that public? No. Okay. So that's not public either.
Nope, not yet. So the state has come out with a couple of webinars in the last 2 weeks that provide information about what to expect going forward. And I think the key point there is that when these true requests for proposals or requests for applications do come out, they come out and they're listed and posted. And generally there's a 2-week period where anybody that is intending to apply for the grant or the funding has to submit a letter of intent. There's usually a PDF that you can click on the RFP that's out there. And within that, it says letter of intent. You must send this email with this letter. And it kind of gives you the format. It's supposed to be kind of short and sweet. Like, I intend on applying for these funds.
It's just kind of the formality piece of things.
Yes, it is a formality.
Okay.
The thing with that, though, is if you miss that deadline to submit the letter of intent, you are no longer eligible to apply for the grant funding. So that's key one. Like, submit those letters of intent, even if you decide that, turns out we can't do this. If you don't do the letter of intent, you are not eligible to apply for that.
Okay, so even if you're thinking about doing it, just do it, because otherwise you're totally not going to. Okay.
And it kind of makes sense when the state described why they did it that way, is that if they had a funding opportunity and 50 people applied for that, they want to make sure that internally they can allocate reviewers for all those applicants. So they have enough people that can review all the applicants in time and to make the award by a certain date.
So it gives them a little bit of knowledge of like, this is how many people this is how many proposals we're expecting to receive. We want to make sure that we have enough people that can actually do the review. So it's not like, we don't know. And all of a sudden we've got 2,000 of these and we don't have people that can review.
one person assigned. Right. This is due by Friday. So that actually makes sense. So
Yeah, and that's a standard ish in the proposal process for a lot of governmental entities. Of yes, you have to tell us that you're planning to do this. So okay, there.
the reason I bring that up though is that if you look at it, generally hospitals aren't getting a lot of grant funding. It's not as a nonprofit, maybe you are a little bit, but if you're local and you're small, you're generally not going out for a lot of grant opportunities. So sometimes things like the Rural Health Transformation Program and the Provider Relief Funds, that was a whole new activity for a lot of people. Like, grant funding, what does that mean?
Right.
What do I have to do with this? What kind of policies and procedures and controls do I need to have in place? And I'm a one-person show in this business office. I don't even know. I'm just trying to keep up with my day-to-day. So it is something new. So we're trying to tell the facilities that we work with, like, okay, we're monitoring this. You need to monitor it internally. If you're not sure, submit that letter of intent and figure it out later.
Right.
Yeah, not a great strategy, but a strategy nonetheless. Right.
I mean, honestly, figure it out later is kind of how all of us operate anymore. So just like, we think we're going down this route, but we don't know, we'll figure it out.
So those will be coming to the individual grant opportunities will be listed separately out there. I would recommend that organizations review that on a daily basis because sometimes there's not like a heads up like, hey, on March 30th, we're going to release these funding opportunities. Sometimes they do that where they're like, okay, by the end of March, which logically is just next week.
I do, weirdly. Yeah. All of a sudden.
So monitoring it daily or weekly, maybe a couple times a week or something, just to make sure that you're aware of things that come out there. The next step is to identify somebody within your organization that can do grant writing. And maybe not writing the grant, but writing the applications for the grant.
Okay.
I would recommend that in a hospital, like your C-suite, so your chief executive officers, so financial operations, maybe it's just department heads, that you bring that group of people together and say, what needs do we have? Here's these focus areas and initiatives. What could we do internally to do that so that when these applications or these requests for applications come about, we're ready to jump on that and say, okay, we think we can do this program, or hey, we have this need and we think these grant dollars can help support that.
Okay. So these look like they're kind of a one-to-one-ish sort of thing. We think we can take this need and
these will
fit
all be like one-time fundings too.
Oof, okay. All right.
But that's okay. We'll take any dollars.
No, that's right. Any money we can get, we'll take it.
The other thing to consider is that with all of these fundings, there are budget caps, percentages noted. And I feel like that part has been kind of a new development that maybe got not overloaded, but maybe just not a big focus for people. So when they're putting together these plans for how they might use the fund, I think they need to refer back to these budget cap areas. Yeah. So for example, administrative costs, no more than 10% of the total award can be used to fund administrative costs.
Also, kind of similar. I mean, a lot of grants will say that because they don't want you just hiring administrative staff when what the purpose of the grant is to really serve the residents or whatever. So I guess I get that.
It does. The administrative part for sure.
Yeah. It's also very arbitrary because it just sounds like, well, we picked a number and 10 is round. So yeah, that part is kind of the icky.
The next one is, I think, the one that has caused the most frustration among states and organizations. So this one's called provider payments. No more than 15% of the total award per budget period can be spent on provider payments. What are provider payments? Mm-hmm. That would be like, okay, well, I need to pay, Medicaid isn't paying anymore, so I need to pay the hospitals, but I can only cap that out at 15%. So CMS came out with their initiatives. The state has that, so the state cannot fund more than 15% of shortages from other.
Oh, no, so that's rough.
So it's like, well, this whole package was kind of meant to be a sweetener for these Medicaid cuts, but when you're only going to allow you to help supplement up to 15% of this funding.
Does not seem high enough at all.
Yep.
especially with
The fact
shortages.
that they actually just put a cap on it and just instead of just leaving it out.
Yeah, because
altogether.
it would be nice if they just allowed states providers, whoever, to make those determinations instead of arbitrarily signing yet another percentage pulled out of air. That just sounds nice.
When these funds came out or were being talked about last summer, we were like, this is great. Hopefully they just send money to the facilities to help them
Yeah.
in this time of need. But that's not how that works. And that kind of does make sense, but they were specific about the 15%.
So yeah, that also feels. I get if you're trying to do a program, what the ultimate goal of the program is, but at the same time, if you're going to give these dollars out, just let the people decide how they need to be spent.
Give it to the facilities and
Yep.
we'll move forward.
Exactly.
The next one was infrastructure and capital investments, so no more than 20% of that. Not a big deal. The next one was electronic medical records, EMR, EHR, sometimes that goes interchangeably, electronic health records, electronic medical records. So
Sure.
the software replacement, so no more than 5% can be used for that. And that has probably been one of the most frustrating things at all. Because this grant was meant to get hospitals or facilities set up to provide rural health care, right? So all of that is based off of technology. So the software that's used to bill and chart and organize your data. Software generally lasts about 3 to 6 years, kind of depending on what that is.
It's a huge spend now.
And for a hospital, replacing your current EMR system can be in the millions of dollars, right? Generally, it's millions. And then on top of that, when you do enter into a new contract, there are yearly service, maybe it's monthly, quarterly, but there's a yearly service cost on top of that. So it just costs a lot of money. And when this funding came out, we were like, great. If someone can help at least cover that upfront cost with these grant dollars or a part of that, great. The facility can use that money that they would have used towards the EMR to provide healthcare.
Right? Yeah. Awesome.
5%. It is such a small number. Why even?
Why bother? Yeah.
Why bother? You think $1 million, hot math here, $1 million piece of software,
Never.
5% would be 50,000.
That is nothing.
And it's like, that is maybe 2 years worth of service costs related on that software.
So you're not even talking about replacing the actual software. You're only essentially covering
Maintenance fees on it. I mean, facilities will have to replace their EMR anyways, but this funding is not going to help with that. So that was kind of frustrating because we were hopeful that maybe some of our rural facilities that have old software that it's time to replace that this could have been an option. So they'll just have to find other opportunities. They also have said that these funds are not intended to fund construction projects or remodeling. Kind of makes sense. The government's not going to pay for a new hospital. But at the same time, you look at our rural facilities and they're not up to date. And so that's a need that they have. And if they can't get some support somewhere to help with that, that is where these facilities kind of fall off the radar or they make decisions to close the facility. So
You can't update, and then you can't provide patient care that you need to.
you're not getting your Medicaid payments like you were. So you have less money coming in the door. Grant dollars are restricted to certain things so you have to come up with these new innovative programs or technology. But at the same time, you have your daily payroll and service costs that you got to follow.
So they want some new fancy schmancy programs, but at the same time, just the very basics is actually what a lot of facilities need.
Yep.
Yeah.
Yeah, so those are the big budget caps that are out there. So that was also a concern that people have come up with. All right, other states, other things that I've read about that states are doing. Wyoming is doing something really interesting. And I'm not sure if their official application was approved by CMS for this part of it. Instead of coming up with all the initiatives that are meant to fund 5 years each year, a portion of their funding, they are going to put in a perpetuity fund. So like an endowment fund. So it's basically like the state investing a pool of funds that are meant to be held like in perpetuity means like forever.
Yeah.
Their thought is they put that large dollar money into this fund and the fund's earnings over 20, 30, 40 years will help fund rural health care.
So they treated it like a giant savings account, essentially. That's pretty cool.
Genius.
Yeah.
I think it's brilliant. It supports the sustainability term
Right.
that's in this funding. And if they designate those earnings to be used on rural facilities or rural healthcare in the future, why is that not a great idea?
Yeah, because then you really aren't relying on additional government funding.
Right.
You took the money that you have from the government, you put that away, and you're just living off the interest, essentially. That's
And so they're saying, like, in years to come, they could be earning like $20 million a year on earnings that can be then sent to our rural hospitals and facilities and help them fund. So I think that is still subject to maybe criticism by CMS of whether they'll allow that or not.
because I'm sure CMS is trying to look for big flashy things of like, oh yeah, but we put these cool programs in these rural areas. So a savings account, not really sexy.
Yeah.
Very practical.
Even though we like that.
We like it. Very smart. Love the idea.
Yeah.
They'll be like, what do you mean you put it in a slush fund? Oh,
Yeah.
well,
Well, not exactly.
if sustainability is the goal here, this is probably one of the more sustainable things you could do with that money is make it grow. So,
Make it grow and make it long term.
Yeah. I'm actually
Legitimately long term.
I'm surprised that the government didn't require that. Like, okay, we are going to give you this money, but you got to stick it in you got to stick it in a high yield savings account,
Right.
and then live off the interest, something like that.
So it's interesting. They're the only state that I've read about that is doing something like that. So it was kind of different. They submitted their initial application that had their own initiatives that aligned with CMS's initiatives, but they amended the budget after the fact. So interesting. That's what I think that is what is still being subject to determination whether CMS approves or not. But I love that idea. And it wasn't all the funds. It was just a portion of the funds to be put in there. And then there is some like current projects that they're doing. So
That's a really good compromise too, because you are essentially trying to do what it is that CMS wants you to do the programs, do the cool things, but also being responsible for
but long term.
right. What happens in 10 years, like we said, and the money goes away, then what do you do?
Well, yeah, in year 6, like, is that current administration going to refund this RHTP grant opportunity? Or is that just going to be done? We still have all these Medicaid cuts that are in effect during those years after year 5.
or will Wyoming have made so much money that the government's borrowing it from Wyoming?
Right. Suddenly, we're paying all of our debts out of Wyoming's budget. It's great.
So that's the gist of what is going on as of today. Today is March 26th. Most states have the same or a similar timeline where they were starting to put out these RFPs and RFAs starting March, April. And then the intent there is that the applications will be reviewed over the next couple months and the funds themselves will be distributed through these like subcontractors to the subrecipients, which are hopefully the hospitals, nursing homes, clinics, all the healthcare people. So those funds they're estimating will be distributed during June and July. Okay. Based on the applications that they receive March, April.
2-month process, 2-month distribution process.
Yep. The general thought there is that in the year of the funding, you have until the next fiscal year's end date to spend the funds. So the state of South Dakota has until, I think it's end of September or October of 2027 to distribute the year 1 funds.
Okay. To it. So, in this money that comes from the federal government, states, do they have to do any matching or anything like that?
There's not a matching requirement yet. So the states themselves could write that in their own initiatives to say, hey, subrecipient, you have to have a matching part. But I haven't seen that yet. All this funding, they'll always have until the next year to distribute the funds and show that they've expended it. So it's all about how you spend the funds. What does that mean for a hospital that ends up getting, let's say they end up getting a grant fund. They've never had grants or they've had really small grants before and have not had to consider what it means to manage grant funds. There's a whole nother world of auditing called a single audit. So anytime a facility, the general rule right now is if you expend more than $1 million of federal funds in your fiscal year, that is subject to a secondary audit called a single audit. So an audit of your federal awards. Generally, accounting firms that provide audit services might also do single audits. Casey Peterson does single audits.
Just a little
Familiar with that. The key thing there is that anytime you accept federal dollars through a grant, that is subject to those single audit requirements. Not all grants are.
Right.
Like Medicaid is technically a federal dollars, but expending Medicaid dollars doesn't go into that $1 million threshold.
So there are certain categories.
Yep.
Okay.
Certain grants are, certain grants aren't. But generally, if you're getting federal dollars, if you expend more than $1 million. So setting up a tracking system. So you get a grant and it says you can only spend these grant dollars on these XYZ. making sure that you can go into your general ledger and you can say, yep, these accounts or these categories are my federal expenses for this grant, tracking every single dollar that you got, how you spent it, working with your local CPA or your current audit firm and keeping them aware. Say, hey, I got these grant dollars. I might need a single audit because I might be right at that $1 million threshold, or I know I'm going to be over. I got the funds. I don't know if I expended them all by my year end, but I don't know. I think getting ahead of it, letting your CPA firm know that that's a possibility so that they can plan accordingly.
Which, of course, is also an additional expense for those healthcare facilities to pay for a single audit.
But you know what? Those costs are allowable.
Oh, okay. Thank goodness.
So they did generally build that in, that if you need a single audit, the cost of paying a CPA firm to do that is a type of is a compliance thing, so it isn't allowable.
If you'd like to learn more about allowable costs in healthcare facilities, we have podcasts on them as well.
I know. I'm listening.
And please check on let's check on our show notes about single audits and our services there.
So I think if a facility has never gone through a single audit, working with your current audit firm and just saying, what do I need to do? How do I prepare for that? Because most of them, CPA firms, are more than willing to help you get your things in line.
And they have other clients that have been single audit, so they probably can tell you, like, here is the process that you need to go through to be ready for this.
And generally, in a nutshell, a single audit is just testing those expenses that you claimed in that year towards that grant. Like, did you spend it on the right things? Did you not spend it on things that are not allowable? Did you report like you should have? I think there's 13 different compliance requirements that are out there. Not all of them are applicable. So understanding what your grant is asking you to do and making sure that you are doing it.
Okay. Sorry.
Resources that are out there, all states, I think. I haven't looked at all 50, but I have looked at like 15. The Department of Health has created a new webpage to track these rural health transformation program initiatives and stuff. So go out to your local state's webpage. All the information is out there. The timelines, when things come up, most of them are putting all that information out there. Okay. CMS has also come out with their frequently asked questions, which it cracks me up because this document is 52 pages long as of today, and there's 68 FAQs out there. So you're telling me that frequently asked questions, there's 68 of them that are out there, but they're not sorted in any manner. So if you're not sure, you can go read through it. And I did read through a lot of those.
Is it a searchable document?
It is. Okay. Thank goodness it's searchable. But
Loaded into ChatGPT. Summarize the FAQ for me.
yeah, when you get a 52-page document, that's exactly the same. This is they use the AI to write it.
Yeah.
And then lastly, working with your local CPA firms, especially if they have a healthcare industry focus. They are probably watching these funds as well. There's also local organizations like South Dakota has an HFMA chapter, Healthcare Financial Management Association, that puts out information on this. South Dakota also has an organization called SADAHO. So it's the South Dakota Association of Healthcare Organizations. They have information out there. They've also hosted some webinars, which have been great, just to give people access to information. So
the information is out there. You might have to do a little digging. You just Google it. You just Google it. It's how we do everything. It's how we know how to live our lives. We just Google it. And as much as possible, we will keep in the show notes all of this information, all the links to everything, so people can have kind of a one-stop shop resource for that.
And you know what? In 2 months, everything that I said today will probably be
We'll have a follow-up episode.
That's right. We'll just go back and try everything that actually happened. So
it's all different. But we are, we're closely monitoring this. While the Medicaid funding and the ACA funding cuts will be very detrimental to healthcare in general, including our rural facilities, we will take advantage of these opportunities. And when I say we, I mean advocating for our rural facilities and helping them make sure that they're applying, sending that letter of intent when that deadline is due, just to try to help them get more money in the door to provide health care. Thanks for having me on the pod.
Thanks for being a long-time listener, first-time guest.
Yes.
And now the legal stuff. This podcast and associated communications are intended to provide general information about tax, finance, investment, and other financial matters. Although Casey Peterson Ltd has made every reasonable effort to ensure that the information provided is accurate, we make no warranties expressed or implied. Be aware that this is not a comprehensive analysis of the subject matter covered. It is not intended to provide specific recommendations to you or your business. Advisory services offered through Vantex Planning Partners, Inc., a registered investment advisor. Securities may be offered through a Cetera Wealth Services, LLC, member FINRA, SIPC. Additional advisory services may be offered through Cetera Investment Advisors, LLC. Cetera named entities and Vantex Planning Partners, Inc. are affiliated 3390 Asbury Road, Dubuque, Iowa, 52002 563 582 2855. Check your financial professional's registration status on brokercheck.finra.org and/or advisorinfo.sec.gov. Cetera named entities and Vantex Planning Partners, Inc. are independent of and unrelated to Casey Peterson, Ltd.
Hey, Hillary.
Hey, Evan.
What was the doctor's advice when I told him that I broke my arm in 2 places?
I don't know. What was it?
He told me to stop going to those places.
Good one.